Hi everyone, you're tuned in to What's Up Doc, and I am Tanya. As a general population, sometimes we don't understand what joint disease means. There's so many different ways in which it can present itself. Today we're going to talk about rheumatology. And what rheumatology is, it's a study of the disease of muscles, joints, and connective tissue, whether it may be by systemic inflammation or autoimmune disease. Now, if you don't know what I mean by systemic inflammation or autoimmune disease, I had a chat with rheumatologist Dr. Keisha Davis King, and she talks to us about some common rheumatological conditions in Trinidad and Tobago. Let's have a look. We are talking today with a rheumatologist. That word is something that people hear and they're not sure what it is. Can you tell us a little bit about what rheumatology is?
You're entirely correct. It is a subspecialty of internal medicine. It's not the most popular specialty. However, when needed, everyone is aware. Rheumatology primarily involves autoimmune conditions, of which most known or most common is lupus, as well as arthritis, osteoarthritis, or inflammatory arthritis, of which rheumatoid arthritis is the most common. And that is a basic overview of the specialty.
Right. So you're right. You know, people hear about rheumatology and they're not sure what it is, but then they hear lupus and they connect the two because a lot of people know somebody who has lupus.
You're correct.
So let us get in a little bit to lupus, which is, I know the long term is SLE.
Mm-hmm.
So can you tell us a little bit about what lupus is?
All right, well, lupus, broadly speaking, it is the prototype autoimmune condition. When most people make reference to lupus, they usually refer to SLE, which is systemic lupus erythematosus, right? There are other subsets, such as cutaneous lupus, which is primarily skin involvement. There's also neonatal lupus, where it involves babies. But the most common type, or the one made reference to, is systemic lupus. As the name implies, it is lupus that affects multi-organ. I try to think of it from head to toe. So at any given time, any part of the body can be involved, and you can present with any symptom at any time.
Mm-hmm, mm-hmm. So you mentioned all the different manifestations of lupus, and you said it's an autoimmune condition. I think that's another word that people probably aren't too familiar with. What do you mean when you say autoimmune?
So it's best approach, so your body has natural defense mechanisms such as your white blood cells, etc. And they usually respond to fighting away viruses, bacteria, etc. What happens in autoimmune conditions, what we know, your immune system does not work as it should. Yeah. And it now recognizes your normal body tissue as abnormal. Mm-hmm. So it is a heightened or overdrive immune system. Mm-hmm. And as such, it targets a lot of your body's organs as well as the natural or normal cells. Mm-hmm. And that's why the manifestations are so varied.
So varied. So what are the more common manifestations of lupus if you do present with lupus?
So one, the symptoms are very vague. It is it is known as the great mimicker because a lot of conditions mm-hmm. can look like lupus. Mm-hmm. So when usually talking to patients relative, I split it up into things that you see, things that you observe, the things that are not obvious to the eyes that we look for. So the things that people really report would be hair loss, right? Which can be from patches, the thinning of the hair, then rashes, which may be worse with sunlight, and there are joint pains, may or may not have associated swelling, then a general sense of fatigue, mm-hmm. muscle aches, muscle pains, tiredness, and sometimes what we call constitutional symptoms, which is like fever, weight loss, night sweats. And those are some of the things that people would report. And things that we look for would be involvement of the kidneys, mm-hmm. blood involvement, nerve mm-hmm. involvement, etc.
Mm-hmm. So basically your body attacks your own body, if I simplify it.
Yes.
Yeah. So, I mean, a lot of people are aware about lupus. They have relatives with lupus. There's Lupus Awareness Month. Is there any advice you could give to somebody who has a relative who suffers from lupus? Because I know it's a very like a long-term condition that you have to continuously be going to the doctor. Is there any advice that you could give in terms of that?
Yeah, you're 100% right. So lupus has a certain connotation, a certain feeling when you're given the diagnosis. If it is a very serious condition, yes, it is. And in our population, because of our ethnic distribution, it is more severe than, say, for instance, a Caucasian population. That being said, what I would advise is information. And what that means is, one, being familiar with the actual diagnosis, things to look out for, and understand medications too as well, side effect of medications, and adherence to follow-up too as well. Because some clinical course could vary from being mild to moderate or severe, and there are times when patients may not feel that unwell and they may skip appointments, etc. But as I said, there are certain things that we still look out for despite not having symptoms.
So is severe lupus a death sentence? A lot of people say, well, once they get severe, that's the end of things.
It is, it does have a certain mortality. I can't say no, but it depends on the manifestation. It depends on, one, how quickly it's picked up and how aggressively it's treated. The two feared complications, or those that we're particularly concerned about, would be what we call lupus nephritis, which is kidney involvement, which can lead to end-stage renal or require dialysis, as well as what we call neuropsychiatric manifestation, which is involvement of your brain, nervous system, etc.
So we're talking about lupus as an autoimmune condition. There are other autoimmune conditions. Another one that comes to mind is rheumatoid arthritis, which is another common autoimmune condition. Can you tell us a little bit about that one? How does it differ? Is it common in our population?
So rheumatoid arthritis is actually quite common. It is the prototype arthritis. So lupus is a prototype for connective tissue disease in autoinflammatory. Rheumatoid arthritis is a prototype for inflammatory arthritis, of which it is an autoimmune condition too as well. However, the pathology or the condition usually starts with increased inflammation in joints. So you'd expect, I think it's important to mention too as well, it's usually a young female. Most autoimmune conditions predominantly involve females, particularly younger females too as well. So rheumatoid arthritis particularly involves small joints of the hands, both hands usually, and you can have systemic manifestations as well. But if it is treated early on, there is, within the last few years, we have made a lot of progress with medications, biologics, etc. So I think a lot of patients are familiar with Humira, Enbrel, and all these biologic agents on TV now. Unfortunately, we have access to some of them in the public and private health sector now. So rheumatoid arthritis has, we have good treatment options that could almost tailor to like first world setting.
And they talk about people with autoimmune diseases being a vulnerable population, but I suppose some people may not understand why. What is the reason that they're vulnerable during this time? You know, we're right now in a very difficult time. We're in COVID times. And a lot of people are getting advice about, well, you know, there's a vulnerable population. And they talk about people with autoimmune diseases being a vulnerable population, but I suppose some people may not understand why. What is the reason that they're vulnerable during this time?
Well, COVID is primarily a viral infection. And as such, to fight off any infection, you need a robust immune system. In autoimmune conditions, as we outlined, it is not as robust as it should be. It's not functioning as it should be. And on top of that, we usually administer medications that regulate or change the immune system. Right? So a lot of patients wonder if they fit into so there's, at least from guidelines and rheumatologic standpoint, there are no risk, intermediate risk, very high risk, and high risk groups. A lot of it is based on the underlying connective tissue diseases, and very broadly speaking, I would say most of the connective tissue disease conditions fall under high risk or very high risk. And arthritis comes into play more based on the medications, as I mentioned before, the biologics. So patients who are on steroids, methotrexate, or some of the strong immune they are more susceptible to as well. So you have to take extra precautions during this time.
Just out of interest, have you had any patients who have an autoimmune condition who have gotten COVID, and is there any outcome that you know about?
So we actually had one patient who was COVID positive and admitted, and she did well overall. She was not on particularly high. She was a lupus patient. She was not on high immune suppression, so they'd usually call for consultation in terms of adjusting. Now this is what I'm aware of, and there's a global registry as well looking at COVID patients in rheumatologic conditions as well.
Okay, so I mean, we spoke about autoimmune conditions, and you know, a lot of times people walk around with a diagnosis. So we talk about lupus, we talk about rheumatoid arthritis, we talk about all these different types of things, but there's some people who are along a spectrum of disease. And you know, sometimes they may go to their rheumatologist, or they may go to their doctor, and they're told they have an autoimmune condition, but they don't essentially have a diagnosis. Is there a large population of people who don't have a diagnosis or are along a spectrum?
I would say yes, and it's because of the nature of the conditions. At any given time, any symptom could be predominant, right? And I would say there's some patients who they have a feel or bit of arthritis or bit of connective, but they haven't fit into one category. And the term that we use, because a lot of patients, understandably so, they like a term, something that they can relate to, and the term that we usually use is undifferentiated, and it can be undifferentiated connective tissue disease or undifferentiated inflammatory arthritis. And what I usually advise, when you have a diagnosis of undifferentiated, at any time it can evolve. Three of the things could happen. It could stay the same as undifferentiated. It can evolve into a particular subtype, or in some patients it actually go into remission.
Okay. I mean, you know, a lot of trainees, we get joint pain. Rain fall and your joint starts to hurt, and people assume they have rheumatoid, or they assume they have something. So I'm sure you get a lot of that.
I definitely do, and I spend a lot of time explaining. So some people think they have joint pain, and it's not actually isolated to the joint. It's generalized aches and pains, and then there are other conditions that we look for in that scenario. It's also important, sometimes people may go to a physician and they say your rheumatoid factor is positive, so you definitely have rheumatoid arthritis, which is not necessarily the case either. So to make a diagnosis of anyone, connective tissue disease, arthritis, etc., is not solely based on blood tests. It's a combination of blood tests, particular type of symptoms, and physician, I guess for want of a better word, how convinced the physician is to fall into any one of these category.
So you mentioned blood tests, the physician overall assessment. Would there be a pattern, a specific pattern of disease that may happen specific to one versus the other?
So like say for instance, as I think we outlined a bit of lupus, there are other overlap symptoms or syndromes where they may have underlying autoimmune condition that overlaps with lupus, and there are certain things, like for instance, just off the top, lupus, we don't only may experience an arthritis or arthralgia, which simply means joint pains. We need not necessarily expect erosion or joint destructions, which occurs particularly with rheumatoid arthritis. So sometimes they may have a overline, like say rheumatoid arthritis and lupus, where we call lupus, a condition we call lupus.
Lupus?
Lupus.
Okay.
It's an old term, right? But it's an overlap syndrome. And sometimes, depending on how predominant the features at the time, will determine what subtype of condition we think may be occurring at the time.
Okay. And you mentioned a little bit earlier that autoimmune conditions are more predominantly seen in women. Is there any reason for that, or is it just how it is?
Well, it is how it is. We're not entirely sure. Well, we can infer the fact that it occurs primarily in women, that there probably is some hormonal component, right? A lot of the conditions like lupus, etc., we know there are some genetic subtypes that predispose to lupus, but vast majority we are unsure what are the actual causes. Because some patients will come to me and they'll be like, how did I develop lupus? There's no one else in my family, etc. And I would usually say, we don't know. And when we say multifactorial, or environmental. It's when physicians themselves are not entirely sure as well, right?
So big words to say, I don't know.
Exactly,
Yeah,
exactly,
yeah.
exactly.
Nice. So, ladies and gentlemen, you have it. Dr. Keisha Davis, she's a rheumatologist, and she has joined us here on What's Up Doc. Thank you so much for joining us here today. I think it was very informative. There's so many people with autoimmune conditions, and there are a lot of people who don't understand what autoimmune conditions are, and I think you've clarified that a lot. So thank you so much for being here with us today. So we took our cameras back to the Queen's Park Savannah with Dominic Wilkes, physiotherapist, to demonstrate some lovely exercises that you can do at home if you have neck pain. Let's take a look.
So many of us are experiencing neck pain at this time, particularly that we're working from home. There's a lot of laptops, iPads, iPhone screens, and our necks are in continuous flexion as we're viewing these devices. So we have Dominic here today to show us 2 exercises that will be so helpful for us if we're at home. But I will say to you, if you're experiencing symptoms of pain running down the arm, any abnormal numbness or tingling, or just weakness in the upper arm, you want to be sure to visit your doctor or your physiotherapist. Do not supplement with at-home exercises. But in the event that it's just a little bit of neck pain, here are some exercises to help you with it.
So just like Tanya was mentioning, one of the main reasons we get a lot of neck pain is that we're in one position for an extended period of time. Whether we're sitting at the desk on the computer or we're on our phones in the car, that one position tends to cause our muscles to go into spasm, and that's what causes or worsens our neck pain. So what Adrian is going to help us demonstrate right now is just some gentle stretches to try and alleviate some of that muscle spasm. So the first thing he's going to do is just gently lower his chin down to his chest. You want to feel a gentle pull behind your neck, but you don't want to feel any pain or numbness and tingling.
So Dominic, I just want to interrupt you to ask, when your neck is in that flexion position, can you just clarify what the upper back is doing? Is it also flexed? Or how exactly are you holding your upper body when you're flexing the neck?
When you think about the position that we tend to be in, a lot of us at the computer, we're in that slouched position already. So what we're trying to do is isolate those neck muscles. So you want to keep the shoulders nice and tall and only bend the head down to your chest. So this is the first one. The second exercise is similar. You're just leaning your ear gently to one side, like if you're trying to listen to your shoulder. And we're still stretching the same muscle, but just a slightly different part. So in this case, he should be feeling the pull on his left side. And of course, we would do the same thing on the next side. Because these are stretches, you want to hold each one for at least 15 to 20 seconds before moving on to the next one.
So my next question to you, Dominic, and possibly because I may have this problem, but oftentimes you find that one side may be a little stiffer or a little bit more painful than the other. Is there anything supplementary you can do in addition to these exercises that may help one side more than the other in the event that you do have the same problem as you?
So a lot of us, again, because of the positions we tend to be in, you will find that one side may be more painful or tighter. Generally, for these same exercises, you could spend a little more time stretching the tighter side, but then heat also helps with alleviating a lot of this tightness. So before you do these stretches, if you have a warm towel or a hot pack, you could wrap that on for 15 to 20 minutes and then go through your stretching routine.
Thank you so much, Dominic and Adrian. We are here on What's Up Doc, and this is your body.